everyone. My name is Sapna Kedia and I'm from ICRW. It's my pleasure to be here at the Love Sex Data Conference. I'm here to share the findings of our study that we conducted 3-4 years ago on male engagement in premarital abortion. To find out more about the methodology of the study, you can please visit ICRW's website. But today, I'd really like to focus on the findings. The findings of the study were quite interesting for us, and they actually beg to be investigated more. Um, in this study, we focused on young men and how they were involved in their partners' abortion journeys. In fact, we like to call it their own abortion journeys. So, without further ado, maybe I can share a little bit about the findings. These dear caricatures that are made were made by a dear friend and colleague, Annie Vincent. You'll enjoy them as we go through the findings. So, uh, in opposite to popular perceptions, what we found about male engagement in premarital abortions is that men actually were involved from the beginning till the end of the abortion and even later. In some cases, men were not involved because there were caste barriers, there were class barriers, and there was pressure to get married, and men were not ready to get married, and hence they were not with their partners. But in most cases, they were the ones who purchased the pregnancy kits. They were the ones who uh, figured out the transport to the clinics. They were the ones who did a Reiki of the clinic to ensure that it's a little far off from where they live, it's safe. And they were also the ones to get medical abortion pills in cases where the abortion had to be done medically. They also waited outside the clinic when their girlfriends were speaking to the doctors. So, in all of it, we found that men were around, men were involved, and men were supportive. Uh, like I shared in medical abortion pills, abortions, they're getting the abortion pills. In surgical abortions, they're doing the Reiki, they're waiting outside. And what we also found, which is very interesting, is that men have these networks, what we like to call them whisper networks, that they sort of rely on for information. They know these chemists, they have these networks, and because they have more autonomy, they're able to get this information. Unfortunately, we don't view men as involved. We think of them as perpetrators, we think of them as people or human beings who exploit women and then let them be. And so service providers don't engage with men, service providers judge and scold them. And in cases where they do interact with men, they make them feel guilty, they make them feel horrible, and they make them feel immoral. So when we spoke to men, I think one comment that stays with me is a young man telling us that I never thought anybody will ask me what I feel about the abortion. And today, when you're asking me, I feel so strange because, I thought that nobody will understand my guilt that I put my partner through this, and nobody will also understand my shame because I've been made to feel ashamed. So, the other thing that we found is that sexual desire is seen as primarily something that men experience. Sexual desire is not something that's associated with men. Even in these interviews that we did, the men were somehow always the ones to initiate sex. They were always the ones not to use protection. And the women perhaps were giving in because they wanted to hold on to the relationship. So, from the perspective of men, females don't have desire. And from the perspective of females, I think it just reflected fear. So there was no sort of conversation or there's no sort of engagement around issues of female sexual desire. So what is helping men be involved in abortions? One is that they have autonomy and access to resources. And very importantly, love and concern for their partner's well being. In all our discourse on sexual and reproductive health, we talk about safe sex, we talk about sex education, we talk about responsibility. We are missing out to talk about love and pleasure and concern well-being. In our study, and what stood with me as a researcher was the fact that men said, we asked them, why were you involved? Were you scared? They said, of course we were scared, but I loved my partner. I was concerned for her. And I think in the development sector and in our work, we are missing that whole um, focus on concern and well-being. We're making it very textbookish. We're talking about safe sex in a very checklist manner. We have to bring in this focus on concern, well-being, and human feelings. And I spoke about all of this, so I will not spend much time on this. But what we also found is that uh, men are vulnerable. They are vulnerable and they are caught between, gender norms on one hand, which paints them as perpetrators, which paints them as exploitators. And because some of these relationships were also intercaste relationships, they really did have a fear that they would be arrested, they would be accused of rape, they would be even murdered in some cases. So that those norms on one hand, and the other hand, the vulnerabilities that they face as a partner, as someone who wants to be there for someone they care about. So when we talk about men and their engagement, first and foremost thing, if you can take away anything from this experience, is to talk to them, capture their voices, hear them out. Second, you talk a little bit, you try to figure out about concepts of young men, young women, and pleasure. Where is sex in all of this? What is their relationship with sex? Is it one of fear? Is it one of um, voyeurism? Is it one of fun? Is it one of pleasure? So we have to figure that out. And when we talk about sexuality, we shouldn't make it boring. It's fun, it's exciting. It can be a lot of fun to engage with young men and even young women on these issues so that that ultimately can lead to responsible, fun, and safe sex. We're somehow doing it the other way around. And I think most important thing is when we talk about premarital sex, when we talk about male engagement, when we talk about relationships, we must keep in mind feminist ideas of dignity and honor. And on the slide, it says women's dignity and honor, but of everyone's dignity and honor. So I think that's the most important thing. So men are involved, men want to be involved, maybe not all men, but definitely some men. And that's a beginning. And the study is very small. So we need to talk to more men and understand. And we need to talk to young people about safe sex in a manner that's fun, that's exciting.